Hugh Montgomery is an intensive care specialist and professor at the University College London. Thank you very much, Professor, for being with the program once again. Can you tell us what's life like in London now, and what's the official strategy around suppressing the virus, if in fact there is one?
Well, I suppose like many countries, life hasn't reverted in any way to normality. So bars, pubs and clubs are open, not clubs particularly, but bars and pubs are. And people are being encouraged, in fact, with a formal sort of stimulus package to eat out, but with social distancing. So people are going out nowadays and distanced. London Underground is nowhere near as congested as it used to be. We've clearly got no tourists this season at all. And most people are still not going into their place of work. Those that can are still working remotely from home. So I was down walking past Buckingham Palace the other day, and there were 6 people in total outside Buckingham Palace. And at this time of year, that would be absolutely packed solid, as would the Underground. So it's still a slightly strange ghost town feeling. In terms of the strategy that we've got, I mean, there has been a lifting of the lockdown in phases of, for instance, pubs and clubs opening, hairdressers opening and so forth, in a gentle fashion. And we've seen numbers of cases in Britain slowly rising. And the strategy seems to be that of regional lockdown. So in areas where there is a surge, and we've seen those particularly in the north of England, those cities or regions of cities have been locked down again in a much more aggressive fashion to try to control the rise and keep this magic R number below 1, where each person infected infects no more than one other person.
What's it been like in intensive care units in the UK during this period?
It's calmed down. In fact, the units now are peculiarly empty because a lot of the surgical work was moved into private hospitals. Of course, most medicine in Britain is National Health Service. But to segregate the acute field people with COVID from those who don't have it, the elective surgical work has all moved into private hospitals and been siloed there. And we haven't had the big surges of other illnesses. Now, it could be that people are getting sick at home and just haven't presented to doctors, but we're just not seeing very much other illness. So our own intensive care unit, I think, has 3 patients. And I was talking to a colleague just this morning in a major central London teaching hospital. They've only got 4 intensive care patients. So at the moment, we're empty. And we've not got any COVID patients on our ITU at all.
Experts are working overtime to come up with a vaccine, and there have been polls done showing that a lot of people are scared to get a vaccine, presumably because they're scared about the safety of it because it's been done with haste. Is that a legitimate fear?
I wouldn't have thought that it is. I'm much more optimistic now than I was 8 weeks ago about the prospect for a vaccine working. All the signals we're getting, particularly from the Oxford AstraZeneca group, are that the safety testing was really good. People didn't get significant side effects. And we don't yet know, of course, whether it works, but those trials are ongoing. And I think we're probably due to get some results within the next 6 to 8 weeks to know whether the vaccine is effective at preventing the disease. So mostly these safety concerns, I don't think, are substantial, because this vaccine is following the same regulatory path that any other vaccine would. It's had to go through the phase 1 studies, the safety studies, right the way through from animals through to humans, and there hasn't been a significant adverse event rate that we've seen.
Professor Montgomery, thanks again for your time.
It's my pleasure.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.